What's the worst possible thing that a hacker could do? If you rewind 2 years ago, what was dominating the headlines at that time was many of these retail breaches. And we said the story's bigger than credit cards. And pretty quickly we dialed in on the worst thing that an attacker could do would be to kill somebody. That day we started this research.
Hi, I'm Joan Goochild, Editor-in-Chief of CSO, and welcome to another edition of Security Sessions, where we talk about trends and topics important to security managers. Today we're going to be talking about hospital security, and I'm joined by Ted Harrington. He is with Independent Security Evaluators. Thanks for joining us, Ted.
Thank you for having me.
What can you tell us about ISE to start?
Sure. So Independent Security Evaluators, we came out of the PhD program at Johns Hopkins in 2005. We perform security assessments and security research for companies who want to understand how they'll be attacked by sophisticated adversaries.
So you recently concluded some research into hospital security and other healthcare-related venues and identified some pitfalls and shortcomings. What can you tell us about kind of the takeaways of that research?
Sure. We spent 24 months investigating 12 healthcare organizations across the United States, and we were studying to identify the premise: could an attacker harm or kill a patient in a healthcare setting? That's exactly what we found. We found not only that it was possible, but that in many cases it was actually very easy.
And so you weren't looking necessarily at patient data in this too, or was there some research into the securing of records as well?
One of the primary takeaways of the entire research boiled down to the fact that healthcare organizations today, and I'm talking about the business of healthcare, not the way a physician approaches a patient, but the business of healthcare today is focused heavily, almost exclusively, on protecting patient data, and has almost no emphasis on protecting patient health in a cyber context. So ultimately what that means is that organizations who would attack in order to compromise patient records, they're going to have different motivations, they're going to attack different systems, and they're going to perform those attacks in different ways than organizations who would be interested in harming patients.